So my patient has a sacral wound with osteomyelitis caused by MRSA. So with that, I will be taking the precautions of contact, which require a gown and gloves. And some other precautions that I will be taking with my patient are to be in a private room to limit transport out of that room. I'm going to dedicate non-critical items such as a gait belt or stethoscope when going into the room. And after using those items, I will be disinfecting them after I leave. When I'm going to go see this patient, the first thing I'm going to do when donning on is to practice hand hygiene with hand sanitizer. When I'm rubbing it all over my hands, I'm going to make sure that it is completely dry before I start putting on my gown and gloves. And so now the first thing I'm going to do is be putting on my gown. I'm going to slide my arms through and put them in the thumb holes and then over my head. Normally gowns do have a tie that would go around the waist and over my head, so I would make sure I would tie those, but this one did not. Then I'm going to put on my gloves and slide them completely on so they're nice and snug, and make sure that it is completely over the gown when putting them on, so I make sure that the gown does not slide up my arms when I'm working on the patient, and minimizing any contact with that. And you can see me doing this. So once I am done with the patient, I'm going to take off the gloves first by wrapping them around and sliding my thumb under, put them in a trash bin, and then slide my arms through the gown and over my head, still touching the inside of the gown to minimize any exposure, and put it in a trash bin, and then practice hand hygiene when leaving the patient's room.